Hi, my name is Dr. Cheryl Burdette, and I'm the Educational Director for Origins Incubator. So it's always important to examine our bias, and that will always color how we see things. If we're more enthusiastic about natural therapies versus pharmaceuticals, then we'll have a leaning one way or the other. We'll tend to pick up the articles and read the things that are more likely to support that bias, that presumption that we already have. And so it's particularly important in medicine to check this bias. Well, one of the things that was brought up in clinical community this week was a discussion around B6. And it turns out that there are an increasing number of reports of people experiencing B6 toxicity, particularly experiencing neuropathy from that. And so these are people that are likely to have sought out nutritional style care. They begin to experience neuropathy in the first place. Maybe they're diabetic, maybe there's some damage. They read about things that can help the myelin sheath, that can help neuropathies, and in addition to fish oils and alpha lipoic acid, other things that show up in the literature are B vitamins, including B6. So it looks that there are a growing number of reports that when, for example, small fiber neuropathies, which we talked about this week in our community, and what could be causing this. And as we dug through the case, it turned out they kept getting worse on these treatments that one would anticipate was making one better. And so as we looked at the thread, what we discovered was there was continuous use or increases of use of B vitamins at the time they would notice exacerbation of symptoms. And so these increase in symptoms can be thought of in terms of a sensitivity to B6. Now, often we talk about our B vitamins in terms of being water soluble, but it turns out B6 can store in the muscle group. So the way that this can often present is when somebody begins to take more B6 above the recommended daily allowance. Maybe they're getting it from enriched foods, also from multivitamins. Maybe they think, I read that this would be good. They're taking even additional amounts. And then couple that with a dehydrating event. So maybe they were overtraining. Maybe they had a sickness with vomiting or diarrhea. And what occurs then as we get dehydrated, more concentration. And even though it's generally thought of water soluble, B6 concentrates more in the muscle mass than other B vitamins do. So as we dehydrate, it's concentrated more. It ends up resulting in toxicity. And so we know there is B6 induced neuropathies. So the same thing we would use to treat a neuropathy could also cause it if our bias is that nutrition is generally less invasive and nutrition is how we follow that premise of first do no harm, then we still need to just make sure that we're checking that bias. Nutrients, while wildly beneficial for us, if we use too much, can have negative consequences. And this is why working with a clinician that is knowledgeable around this area is quite useful. So B6 is one of those ones that we should check in. And if we see evidence of somebody with increased neuropathy, even despite increasing nutrition, if we see that they had this dehydrating event in their history, and if they have a diagnosis of something like small fiber neuropathy, really think about that B6 picture and allow that to be a next clue in terms of next steps, in terms of getting that patient back to a space of wellness.